Hey, let's talk about another postural pattern. You know, 80% of the population have a condition in their body that starts from the pelvis and the sacrum, work its way up through the head, neck, and shoulders, and then down through the knees, into the ankles, and into the feet. So the condition looks like something like this, to where this ilium, the right ilium, goes forward. And you can see what happens when it goes forward. It tips the sacrum. So what happens is the right side, this is the left side, I'm sorry. The left side goes forward, the right side goes backwards. The right side goes posterior in compensation. The left side is initiating this sacrum to tip, and that can be beginning of scoliosis. But what's happening, the stacking of the vertebrae of the lumbar becomes uneven because it has to right itself to come back this way. So this is called a right torsion because it's pushing to the right. And so 80% of the population have this way. I challenge you, if you're a therapist, take your next 10 clients, stand them up, and do some body reading, and you'll see what I'm talking about. This left side will be tipped forward and creating a leg length discrepancy and all kinds of ways of compensate from the left side and the right side. The right side, you'll see, will look lower from seeing from the posterior side, and you'll see their belt line to be off on an angle. What happens is we get something like this. We get this left ilium coming forward and down, and then beginning to initiate a steering effect this way. So what happens is we get a medially rotated knee and a laterally rotated tibia and fibula, all right? And then a arch that tends to want to collapse more so on this side to make up from this hip pushing forward. All right, so body's just trying to absorb some extra leg lengths so we're not walking like a penguin. Anyway, I hope this helps. I'm excited to teach this class this coming summer. I hope all is well. Please sign up for our classes, www.csbworkshops.com. I'll see you soon.